As disease and public health students, I'm going to use this short demonstration video to mimic what you should be doing as part of this Know Your Immune System Flipgrid assignment. I'm going to choose a couple organs that you aren't going to be pointing out. You're going to have to be pointing out the the axillary lymph nodes, the thymus, the spleen, and the tonsils. You don't need to show me like your open mouth, just point to where they are in your neck. I'll just do an example with your cervical lymph nodes, which are right here in the base of your neck. If you've ever been to the doctor sometimes and they think you've got some kind of infection, they'll often kind of feel right here, and what they're feeling for is if those lymph nodes are swollen. Remember, your lymph nodes, their job is to collect plasma, the fluid that is leaked out of your blood, and check it for any pathogens before it is then drained back into your blood supply. Where that happens in terms of draining your blood supply back into your the fluid back into your blood happens in what's called the ducts. You have your right and left lymphatic ducts. They're actually right here, kind of in your upper chest, right above your heart. The left, sorry, I'll start with the right. The right lymphatic duct drains fluid that's been collected from the right side of your head, your arm, and just part of your upper torso. Your left lymphatic duct drains liquid back into the blood that has leaked out from all other parts of the body. So the left side of your head, your left arm, upper chest, and both of your legs. So there's a lot of liquid going back into the blood at that site there. Down here, right at the base of so this is all your intestines right here, what we think of as our stomach and our gut. It's actually all your small and large intestine there. Right at the base where your small intestine joins your large intestine, this is where your appendix is, but that's also where you have what are called the Peyer's patches, which are MALT. Remember, that stands for mucosa associated lymphatic tissue, which is essentially little collections of guard cells, right? That's how you can think of it. It is lymphocytes that are just sitting there waiting to attack something if a foreign invader or substance goes by. And that is right where the food that you have ingested and digested and you've absorbed most of the nutrients through your small intestine, all that's really left is liquid and waste. Right before it goes from your small intestine into your large intestine, that's where those Peyer patches are basically checking that fluid for any foreign invaders, anything that hasn't been noticed yet, because your large intestine is full of mostly your gut flora. You have lots of bacteria in there that are helpful to you, but that area can be contaminated by bad bacteria like E. coli or something like that. It can cause a lot of problems, diarrhea, constipation, that kind of thing. So that's meant to guard there. So that's just a short demonstration of how you should be pointing out the major organs that I listed on the assignment and just giving a very brief description of what they do. Thanks, hope that was helpful.